Before we dive in, we're recording. That was one of our housekeeping notes I was just about to say. So the session is being recorded, and we'll have time for some quick Q&A at the end. So use the Q&A function to drop your questions in as we go along, and we'll save some time at the end. And also thank you to Fairfax Egg Bank for sponsoring this webinar. I want to start by saying that wherever you are in your family building journey or however you're connected to this issue, that you belong here. And this is a judgment-free learning space, and there are no dumb questions, so please ask away. And most importantly, you do not need policy expertise to be an advocate. This work is about real people, about real experiences, and making your voice heard in ways that actually matter. So I'll start by introducing myself. I'm Elise Powell. I'm the Director of Government Affairs at Resolve, the National Infertility and Family Building Association. I'm joined today by Becca O'Connor, who leads the work at ASRM's Center for Policy and Leadership, the American Society for Reproductive Medicine. And she'll walk us through how the lawmaking process really works. And then we've also got Aisha Ayudu, who is Resolve's grassroots advocacy manager, and also Jackie Bishop, who is a community advocate who will share some personal testimony on what advocacy looks like in real life. And we wanted to bring a mix of perspectives today because advocacy isn't just a one thing, it's policy, it's people, it's personal. And so I have a quick icebreaker if you want to put in the chat where you're watching from and what brought you to this webinar and introduce yourself. Um, and then we'll get started. So, by the end of today, our goal is that you walk away with a few key things, a clear understanding of what we're fighting for and why it matters, a simple and no jargon explanation of how policy change actually works, how lawmaking actually works, and most importantly, where you fit into that process and how to get started because advocacy can feel intimidating at first, and it doesn't have to be. So, the reality of the problem today, this work comes down to something really simple. Building a family shouldn't be this hard. And yet, for so many people, it is not because the science doesn't exist, because we know it does, but because access doesn't exist. And right now, there are real and significant barriers standing in the way of people trying to build their families. Too many people are facing barriers to accessing fertility care and family building care. And if you don't have insurance coverage or fertility care benefits, the overwhelming out-of-pocket costs often puts care out of reach for many people. And at Resolve and also at ASRM, we're aligned in the stance that where you live and what insurance you have or what you can afford out of pocket shouldn't determine who gets to build a family. So our impact to date at the state level, both Resolve and ASRM, along with other partners and stakeholders, advocates on the ground that we work really closely with, we've led the fight to expand access to care in the states. And right now, 25 states have some kind of infertility laws on the books. 15 states have IVF mandates to cover fertility care for private insurers, and 21 states have insurance mandates to cover fertility preservation for private insurance. And only a couple states have laws that mandate coverage for public insurance or Medicaid for diagnostic testing or ovulation induction medication. But this is the current state of where the landscape is for fertility care benefits. And so here's what we're fighting for. At Resolve, we use these guiding principles to inform our policy work of protecting and expanding access to family building care and ensuring that family building policies are inclusive and that they reflect the reality of who needs care today because everyone deserves a fair chance to build their family. And our guiding principles quickly are patient bodily autonomy, free from government intervention, respect for the doctor-patient relationship, using an inclusive definition of infertility, respect for all family building options and all the ways in which families are built, and making sure that policies are in line with clinical guidelines and the standard of care. So in reality, the bulk of our work on the Access to Care team has been fighting against harmful bills that would restrict access to fertility care. And this year, we've reviewed over 150 bills introduced this session. Our team has been very busy, and we've opposed over 40 of them due to their harmful or restrictive nature. And so we've defeated all of them by working in coalition with local advocates, with stakeholders like ASRM, and some of our corporate partners that have lobbyists nationwide. And to give a quick example, in earlier this year in February, there was a harmful and restrictive bill in South Dakota that threatened patient autonomy and the doctor-patient relationship, referring back to our guiding principles earlier. And by attempting to have the South Dakota Health Department track how many embryos are created, implanted, destroyed, or tested, and posting that data on a publicly available website. And so, thanks to the incredible testimony of some of our handpicked advocates in South Dakota and the help of some of our lobbyists, our corporate partners and their lobbyists, and their strategy and kind of guiding us, we were able to, one, draw media attention to the bill, and also to contact South Dakota legislators to persuade them to oppose the bill when it finally came to a vote on the House floor. We've similarly been fighting hard in South Carolina. If anybody is on the line from South Carolina, we've sent you a ton of emails in the past few weeks. Um, and, it's been really impactful hearing from the community. We've gotten a lot of engagement, and lots of people calling and emailing their legislators. And the bill is still currently active and moving throughout the process. So that's kind of a live example of how the impact of our advocacy work. So all this to say that the impact of these barriers to care is real. It can mean delaying care. It can mean losing the time and that you don't get back. It can mean making impossible financial decisions. And sometimes it means that people don't get to build their families at all. And that's why this work matters so much. And so when we talk about advocacy, what we're really talking about is changing these outcomes. And to do that, it helps to understand how change actually happens. Because once you see where the decisions are made, you can start to see where your voice fits in. And so with that, I'm going to turn it over to Becca to walk us through how a bill becomes a law and where advocates can make a real impact along the way.
Great. Thank you, Elise. And hi, everybody. It's great to be here. My name is Becca O'Connor. Thanks for having me. I am, as Elise said, the director of the ASRM Center for Policy and Leadership and recovering director of government affairs at ASRM and other organizations. So I'm really glad to be able to talk with you today and ground us in ASRM and the CPL's role, and then really dive into a little bit about the process of lawmaking and where your voices fall into it, because they are critical in this process. Next slide, please. Okay. Nope, back. I'm sorry, one. I had an intro for myself. Last slide, sorry. Okay. So ASRM is the leading multidisciplinary professional society in reproductive medicine. We have within our membership, which is 8,000 plus members worldwide, scientists, embryologists, attorneys even, and mental health professionals and others who are invested in advancing access to care. The CPL's our policy and leadership hub. It was established in 2020, and essentially it's our think tank embedded within ASRM. And, in that role, we sit sort of at the intersection of science and policy. So, critically, we are also working to amplify patient impact of decisions that are being made at the federal and state levels in the policy realm. And our mission is, simple, but in this time period in particular, urgent, keeping reproductive health policy evidence-based and centered on patients and providers. And that means sometimes pushing back on that misinformation that we're seeing out there, clarifying complex science and translating it, and ensuring that policymakers, as you all do as advocates in your own roles, as we'll talk about, but we are all in this together, making sure that policymakers understand the downstream consequences of their decisions on a day-to-day basis. So together, we're translating clinical reality into policy clarity. Next slide, please. Okay, next slide, please. Okay, so how do we operationalize our mission? No, sorry, I think it's a delay on my end. I'm sorry, Aisha, I'm not trying to drive you nuts. Um, this slide. We operationalize that mission in three ways. One is education, and then advocacy and training. So a little bit about each. On education, we produce fact sheets, white papers, briefings designed for policymakers and their staff. Our latest work, for instance, is a white paper that highlights the real world impact of federal funding cuts across reproductive care, and what it's meaning for both providers and practitioners and for patients themselves. On advocacy, we coordinate closely with our government affairs team and partners like Resolve and ACOG and the Alliance for Fertility Preservation, to just keep track of what's happening on a 50 state and federal basis and make sure that our voices are inserted at the right and appropriate times. And on training, we build the next generation. At the CPL, we're focused on building the next generation of clinician advocates through a program that launched a couple of years ago called Primed, which is focused on helping our members, some of whom have advocated before in federal, in advocacy day settings such as this, who just want to sharpen those skills and be sort of more prominent in their role as advocates for the field. So they spend about a year with us learning about how to advocate effectively and surgically, as we all have to. And I think, it's important to just bear in mind that core principle that evidence and all of this knowledge that we share collectively and experience only matters if it's reaching the people that are making the decisions. So let's get into it. Next slide, and just one. About how this actually all happens, and why it matters right now. And at least touch on some of this, but it's, in part because reproductive medicine is increasingly being pulled into the broader legal and political debates. We're above the fold at every turn these days, and the debates are often happening without a full understanding of the underlying science and impact. So policies being made in real time, sometimes without a full picture. And as the slide speaks to eloquently, it's not a linear process most of the time. So, you might have done Schoolhouse Rock training, but it's a little different when you're in it. So let's focus on what you need to know from your perspectives as you begin this month of action. Next slide, please. Okay, so where do we even begin? So every bill starts the same way. Someone decides something isn't working, and it's usually not abstract. It's personal, or it's visible, or it's something that is impacting their community or causing harm, and that someone can come from a lot of different places. Okay, so it could be a patient or a family navigating gaps in care. It could be an advocacy organization raising awareness and organizing around an issue like Resolve, like even ASRM. And often it's a physician, provider, other expert who's seen the same problem play out again and again in practice and wondering how we can sort of get through some of these common problems to solutions that work for others as well. And sometimes it's a legislator themselves. They'll hear from their constituents. That's a magic word, constituent, and they'll act on an issue and try to recognize that there's a broader trend perhaps out there and they want to jump on the bandwagon and be part of a solution. Sometimes you'll have a group like ASRM, professional societies, ACOG, bringing data and clinical expertise forward to highlight a systemic issue, and that will spurn change. But the common thread through all of this is that policy doesn't start in a vacuum. It starts with someone identifying a gap between what's happening and what should be happening. And you can see that reflected in these images, families, advocacy, clinical care. These are real world experiences that drive policy conversations. As a recovering lobbyist, I can say that I can spend 10 hours on the Hill and talk from the vantage point of a lobbyist, whereas people who have, the clinicians, the patients, the advocates with their personal stories go up there for 10 minutes and it might move the needle even more than those 10 hours. So your voices are vital in this. Next slide. Okay. So once a bill is introduced, the next step is what you see here. It's sent to committee. I call it the room where it happens. And it really is where the action happens. Committees are smaller groups of lawmakers who specialize in specific issue areas. So health, judiciary, appropriations, the spending. And this is where subject matter expertise, at least in theory, should come into play, right? So on this slide, as you can see, this is where several critical things are going to happen. First, hearings. Hearings are often the first public vetting of a bill. And yes, they're orchestrated, but they also are a chance for people to hear one another talk on the pro and cons of a particular topic. Typically, people are selected for their perspective by the committee members in charge. But when there are public hearings and people can come from the public, and that happens a great deal more on the state level, it's a really interesting sort of scientific workshop for you to listen in and hear these perspectives and sort of learn where there are gaps in understanding based on the questions being asked and what have you. So you have experts testifying, and this is where voices like yours can really shape direct understanding. Amendments get made. So sometimes minor amendments are made, let's put the comma here instead of there. And sometimes they fundamentally change the entire focus of the bill. And so that's where groups like Resolve and ASRM are constantly watching those changes to alert you if there's a chance to sort of weigh in. The staff are hugely important. This is going to be a common thread in my comments. I'm a former ledge staffer. I worked in the Massachusetts State Senate once upon a time. And it's really true today's staff members, tomorrow's senators. So they're deeply involved shaping recommendations and advising the members, their bosses behind the scenes. And importantly, this is where the bills are either going to quietly stall or they start gaining momentum and may pass out of committee. So while the floor vote, when the entire House or the Senate comes together and votes, tends to get the attention, the committee is where the real work and frankly, the decision making often is happening. Next slide. Okay. So a natural question at this point is, okay, who actually has power in this process? And the answer is it's not just the elected officials. So yes, legislators are a huge part of this, but they're only a piece of a much larger ecosystem. So if you look across this slide, you'll start to see how many players are actually shaping the outcomes. You've got legislative staff, as I mentioned, who are often the first and most consistent point of contact. Committee chairs who control what moves and what doesn't. They decide whether your bill is going to get a hearing, whether or not, that hearing is going to be one where there's questions asked or if it's going to be rushed through. And governors and other, higher ups in the chain of command here who can decide whether to sign or veto legislation if it does happen to make it through the process. Beyond that, you've got agency officials who interpret and implement these laws, advocacy groups who are shaping the narrative and applying pressure where needed. Coalition partners. We do so much coalition work. We're so glad to have Resolve as a part of our coalition work and groups beyond that because we, as said before, it's not done in a vacuum. But they'll bring scale and alignment to an issue, right? So critically, the most important group, in my opinion, as a former IVF patient and now mom to twin 13-year-old tornadoes, is the patient voice and the constituents whose stories will drive urgency to the issue. And so I think it's just important to remember, again, staff is critical. They will decide what gets prioritized and what gets ignored. They draft the language, they brief their members, they shape recommendations behind the scenes. But that's why this matter. The image on this slide to me really mattered because I wanted to make sure understand the power of the R word, relationship building. The more you can talk to people, whether in the district or what have you, and just let them know that you're there in the community to provide expertise, the better chances of success you'll have. Next slide. Okay, so after all of that, the process, the players, then where do you fit? Where are the entry points? So the key point, is that it's obviously much bigger than showing up at a hearing and testifying. That's just one piece of a broader toolkit. And in fact, ASRM had a campaign a couple years ago that said advocacy is everywhere. And boy, is it. I mean, if you meet any of us on a plane, we're usually scanning for where the senator is sitting so that we can go say hi to them or something. But, not putting that all on you, but just so you understand, look at this list. There are a lot of ways to influence policy, some of which happen outside this formal legislative setting and ecosystem. So you can share your story with lawmakers. Again, often the most powerful and impactful entry point. District meetings where conversations can be candid, sort of less performative than hearings, and you might get a little more time. For instance, if you go in August recess when people are around. There are advocacy days, as you know, through Resolve and ASRM's days, coordinated efforts to bring visibility and momentum, public testimony, of course. I'm not going to go through all these because I know we have a lot to cover, but obviously there are many, many entry points here, and you should learn about each of these and figure out, for instance, in coalition work, are there groups on the ground where you are that you could join up with and start getting their notifications about opportunities to weigh in? And educate your community. For sure, building the broad base that ultimately drives policy change is on all of us, ultimately. Next slide. Okay, so this slide gets to one of the most important and often overlooked parts of advocacy, which is timing. And so to the first point, the earlier you engage, the more influence you're going to have. Once something's already moving, your ability to shape it starts to narrow. Once it's in committee and they have drafts, it gets harder and harder to get your voice in. So again, going back to that comment about staff, get to know them early because they'll call you and say, what do you think about this? Or will you weigh in on this? Second, the best advocacy happens before the bill's even introduced. So that's tied to the first point. So when language and ideas are still forming, that's when groups like Resolve and ASRM and others will call you and say, hey, we need patient perspective or we need your perspective on this. Are you willing to join us in a conversation with this policymaker or staff? And that's really critical and key, and we can't do this without you. Third, once positions harden, it gets harder to change. I mean, that sort of goes across the board in life. But once a bill's public and stakeholders have taken public stances and sides, messaging gets locked in. And so again, all of this meaning timing does matter in the sense that you want to get in as soon as possible. It doesn't mean you can't have an influence at the end of this process either. It just means that it can be a little more difficult. And then, again, this is why the image meet with staff is important. Those early informal conversations will really influence what happens next. Okay, next slide, please. Okay, so I want to close with this because it's really the through line of everything that I've mentioned tonight. Your story will and can move policy. On the left side of this slide, you've got the reality of what lawmakers are hearing every single day. They're hearing stats, they're hearing talking points, and yes, we have coordinated talking points and campaigns, and that's a positive thing. And it's good to show that we all kind of have a shared message because that gives permission in some ways to policymakers to say, I'm hearing the same thing from a lot of the groups that I really care about their opinion. But it also means that you can't count on everybody else to be messaging that. It's important that we all do it. The bigger the course, the better. But what they'll really remember is, as the slide says, the patient who couldn't access care, the family forced to travel, etc. I often talk about some of the most impactful meetings that I had as a Senate staffer were the ones that caught me off my guard, and somebody shared something intensely, either personal or impactful that had happened to them. And 20 years later, I can still remember those staff meetings and going to my boss and saying, we need to pay attention to this one. So don't underestimate your power, because your stories and your expertise and your lived experience is not anything that we can replicate, sort of as a national organization. That's the key here, because policy at its core is about people, not systems. So next slide. Sorry, wrap this up. Um, Again, I'm hammering this home, but I want you to leave with this idea, because it really is at the heart of everything. Policy is personal, right? And that's why your voice matters. And so at the end of the day, this isn't abstract. This is, where people can make change, including you. So, thank you for being here and being part of this process. Next slide. Okay. Um, final, final point. None of this happens in isolation. You're not alone. We did more than as the theme for NIAW this year. We are stronger together. And so, just remember that you have a network here and with other organizations that's ready and able to support you in this work. And last slide, please. Oh, that okay. It was just a thank you. So we're good. I just want to thank everybody for the chance to speak with you, and I really appreciate each and every one of you being here, because you make our jobs easier, but also you're impacting so many others outside this call that it inspires us to keep going.
Thanks, Becca. That was a great rundown of how this process works. So I'm going to pass things over to Aisha to talk about what advocacy looks like in the day-to-day.
Thank you. So advocacy day to day can be very simple, especially if you are a new advocate. We have so many different ways that you can get involved. First and foremost is sharing your story. Your story is the most important thing. It's incredibly powerful. We typically tell people you can practice your elevator speech about 60 to 90 seconds that you can share your story, but it does not need to be extremely polished. It's your story, and you are the best person that can share that. And I think if you look at the chat, Chantel Chelsky, one of my favorite volunteers, says she's been sharing her personal story for 8 years, and the staffers and their bosses remember her and her story. And I think that that just goes to show you how incredibly important that is, and it does make a huge effect. And one thing that's really important to me as well when I'm training people to share their stories is to remember that within Resolve, we can share all the data and the statistics with the staffers, the members of Congress, but you humanize those statistics and those numbers, and that's incredibly important. So one important thing is during the month of action, we will have a webinar this Thursday, how to share your story to reach others at 8 p.m. Eastern Time. So if you'd like to get more tips and just learn how else you can share your story, please go to this website, resolve.org, month of action, and you can sign up for that webinar. It's going to be incredibly instructive and informative. But in general, like I said, your story is an incredible thing. It's your best way to advocate for yourself and for others. And then within Resolve, I put that into the chat, but if you are part of our Resolve Advocacy Network, whenever a bill is introduced in your state or there's a federal bill, thank you, Rebecca, for putting that in the chat for everyone. Whenever there's a bill introduced in your state or a federal bill is introduced and we need you to advocate, we do send automated emails, and within it, we have an action alert system. Everything is completely set up for you. It's very simple. All you need to do is put your name, your address. It will auto-populate with your lawmakers. We'll give you a section where you can add your story within the facts and the other information that we'll share with them, and you can just send your letter immediately. There's other ways that we might ask you to use our action alert system. So we might have you do calls sometimes. And again, that call system is very simple. We have a set of instructions. You just need to dial in. If you put your address in, it'll auto-populate again with your lawmakers. You can dial in directly to their office. You can leave a message or speak to a staffer. And again, we'll give you the script and you're able to, of course, modify it and share your story as well. So that's just a very simple way that you can always advocate. It only takes a couple of minutes. And then the next step up that I would say is meeting with your lawmakers or staff. So whether that's in our Hill days, if your lawmakers, whether state or federal, are back in their hometown and they're doing town halls, or just in general when they're back home, you can always contact them. We have our state advocacy toolkit on our website that you can download. We give you the templates on how to send an email or how to make a call or just how to reach out to them in general. But for our lobby days, we set up everything for you. We'll schedule your meetings for you. We'll give you trainings. And if, again, you prefer to set things up yourself, you can always use that state advocacy toolkit. But again, your lawmaker, just to remind everyone, your lawmakers work for you. You voted them into the office. It's your right as a constituent to contact them and to set up a meeting. And I will say that staffers and lawmakers, they love to hear from their constituents, and they want to know how can they make their state better or how could they make the country better in general. And so it's incredibly important to reach out to them. It can be a simple 10 to 15 minute phone call. It can be a virtual meeting, or you can show up to their office as well if you pre-schedule that and just have a quick chat with them 10 to 15 minutes and say, this is my story. I'm your constituent. I'm part of the 1 in 6, and we need coverage. Here are bills in our state or federally that are out right now, and I would love for you to co-sponsor. I would love for you to show support for this bill. So there's a couple of different ways. And again, all of the bills, federally and state, we put it on our resolve.org website. We have all the information you could possibly need. But if you need additional support, you want to share your story with someone just to run it by them, you can also always contact us. And I'll put our email, advocacy@resolve.org. You can always do that as well. But those are a couple of different ways that you can advocate day to day. And I think one of the most important ways that I've been seeing in the past year or so is that when we have a bill that's been introduced, and as Rebecca's talked about this a bit, but when we have bills that have been introduced and they are in important committees and your lawmaker is sitting on those committees, and we send out an action alert, there's always opportunities for you to actually testify. If there's an option where um, they're allowing the public to testify, we will send that to you in an email to let you know, and we'll give you the options. If you can remotely testify, we'll add the link for you. We'll give you the script, we'll give you everything. And if there's an option for you to testify in person, we'll add that information as well, the time, the location, everything you need to know. And I think that's one of the best ways that you can advocate in recent times is to show up to those hearings and to share your story, and to just let them know that yes, there is a Resolve or an ASRM that's pushing forth this bill, but there are real constituents behind it that need this coverage, or they need to remind lawmakers that this bill that you're trying to pass, your intention might be one thing, but it's actually harming the family building community. So again, those are all the different ways, and you can decide how you want to testify based on your comfort level. And as you test and as you advocate more and more, if you feel more comfortable to meet in person or to testify, you can always do that. But again, there's just a variety of different ways to be an advocate, and all of it is incredibly important. Whether it's you send out an action alert with a letter, whether you make a phone call, whether you show up to testify, or you show up for a lobby day, they're all incredibly impactful. We've seen bills that are harmful be um, shot down in committees because of advocates that have reached out to their lawmakers. And we've seen good bills that, because there's just been such an outpour of support from constituents, pass through a subcommittee just because of that. So I just wanted to reiterate that no matter how you're advocating, it's all incredibly important. And again, you sharing your story is the most impactful aspect of your advocacy. So thank you.
Thanks, Aisha. And now we are going to pass it to Jackie Bishop, who is one of our star advocates, to share a little bit of personal testimony and what she has been doing in the advocacy space and how she's made her voice heard.
Hi, everybody. So as Elise just mentioned, my name is Jackie Bishop. I've been involved with Resolve now for 4 years as a volunteer, but I guess as a lurker, I guess for a year or two before that, when my own infertility journey began. And it's actually really interesting. So the other day, Aisha asked me to speak for a couple minutes tonight about what keeps me motivated to volunteer and to stay engaged in advocacy work. And it was a really easy yes, because interestingly enough, that very morning in my classroom, I was talking with my college students about this idea of small wins. And I had shared with them this article about what keeps people motivated and taking part in meaningful work. And there was this quote that stuck out to us, and we were sort of unpacking, and it was something along the lines of, people are most creative and ambitious and productive when they're happy, when they're intrinsically motivated by the work that they're doing, and that when they feel really good about their colleagues and the people that they're working with. And so I had asked them, does this mean anything to any of you? And they were kind of silent. So as I usually do, I shared my own story. And so what came to mind but my work with Resolve and advocacy. And it kind of fell a little flat with them. So I'm hoping that my story resonates a bit more with all of you here tonight, because I think that thinking about meaningful work in the context of advocacy is perfect, right? Because this work can be really hard. As we just saw, as Rebecca sort of explained to us, the advocacy and change can be slow. There can be a lot of setbacks. It can make you vulnerable, and that all can be very draining. So why do we do it, and why do we keep coming back? And when I asked myself this, I was really thinking about, what got me started was my own experience with infertility. I had unexplained infertility and recurrent loss. We went through multiple rounds of IVF, but I was incredibly fortunate to have access to the care that ultimately brought me my son. Right now, he's 2 years old, and we're deep in the trenches again, hoping to grow our family. And so for me, yes, it was a personal motivation that got me started. But what really keeps me going is that my story isn't unique. So many of my friends and many people who I've met through this community and who are probably here on this call have gone through or are going through something similar. And the more that I learned about their stories and the barriers that they faced or didn't have to face, it just added to my motivation to keep advocating. And so, what makes it possible for me to keep showing up, even when it's frustrating or even when the pace of progress is too slow? It's this community. As everyone has mentioned before me, I've been really fortunate to be welcomed into this advocate group. They're really such a cool group of people, the advocates and the volunteers at Resolve. And there's something really powerful about being around people who just get it, right? These people who are committed, who keep showing up, and who constantly remind you why the work that you're doing matters. And so, going back to that article that I had mentioned, they talk in the article about how change doesn't happen overnight, right? It happens in these small moments, what they call small wins. And for me, it's really been those short conversations that I have with someone on the street about, my journey and how my son came to be, and that might change their perspective on infertility or IVF. It's sharing an Instagram story that makes infertility real for someone who hasn't experienced it. Or it's sharing your story that helps someone realize that they're not alone in their journey. So it's all of those calls. It's every meeting that you sit in on. It's every email that you write, every letter that you send in. All of those, small little bits of progress, it all adds up. And I think that when you begin to see it that way, it becomes a lot easier to stay motivated, right? Even when the big picture feels overwhelming and it feels like, it's this big hill to climb. It's all of those small incremental changes that I think really make the difference and help you keep moving. So yeah, for me, it's really about just staying connected to why this issue matters, to whom it matters to, and to the people who are, in the trenches doing the work. And I've been so fortunate to have found an outlet for my frustration and my sadness and my anger and all of those emotions. So that's really what keeps me here and keeps me motivated to keep on advocating.
Thanks so much for sharing, Jackie. I love that you framed it as an outlet. I hadn't heard that before, but that makes a lot of sense. All right, so we have heard from, and we've talked about what's at stake and how the process works and what advocacy looks like in real life. And Jackie has shared her why, and I hope some of that resonated with you. And so the next question really is, what can you do from here? And the good news is that you don't have to figure it out on your own. Aisha laid out a lot of steps that we do at Resolve to make it easy for you to engage. Once again, one of the easiest ways to get started is by joining Resolve's advocacy network, and that's how you'll get connected to the action alerts that she talked about. So when a bill's moving in your state or at the federal level, you'll get opportunities to contact your lawmaker and ways to plug into this work in a way that fits into your life. Um, and then if you're an ASRM member, you can explore opportunities like ASRM's Prime Scholars Program that Becca runs and spoke about earlier. And we hope that you also continue to participate. This is the first official event of the month of action. We've got lots more to share for the rest of the month. The next one is May 7th, that Aisha mentioned, is How to Share Your Story webinar. That'll be really exciting and really a great second step to layer on to this Advocacy 101. We've also got an action alert day. We've prepared some action alerts for some federal bills that we support that's happening next week. We've got another webinar on May 18th, Stronger Together, Men for Access to Care, that Rebecca Flick is going to be leading, our External Affairs VP. And we've also got a phone bank day that we're organizing on May 20th that we're really excited about. We haven't done one before, so we're really excited to give this a try and see if we can get as many of you as possible to join in on May 20th. And then our final webinar of the series will be the Lived Experiences webinar. You'll meet some of our community members and stakeholders that we work with that are fighting for family building care. That's on May 26th. And then on May 27th is Tag Your Lawmaker Day, a social media engagement. That is a quick and easy one, and I hope everyone can engage on that one. And then we'll close out the month with a happy hour that'll be really fun on May 28th. So those are the highlights of month of action. And there's so many entry points. All of them matter. We're really excited also about our event next week that Resolve is hosting. We're piloting a return back to our Federal Hill Day in person, which is a huge step towards giving more advocates the opportunity to meet directly and in person with their lawmakers and share their stories. So it'll be a small group of folks that we're leading on the Hill next week, and our goal is to keep building on that and expand those opportunities in the future, so we can have as many people that can join us in the years to come. Because the more voices that we bring to these conversations, the stronger that we are. And so I will close with, just repeating that change doesn't happen all at once, and it doesn't happen because of one person. It happens because people show up, they share their stories, they take the small steps, the small wins over and over and over again. And that's really what advocacy is. You don't have to do everything, you don't have to be perfect, and you just have to start. And we're really glad that you came here and you started with us. So, with that, we will wrap the presentation and move into some questions. Thank you again to Fairfax Egg Bank for sponsoring this webinar, but we can get into some questions. Aisha, I don't know, I can't see the chat, but let me know if there have been any questions we can answer in the chat.
So I've been answering a lot of them in the Q&A, but I think I can repeat this. So Susan asked, how do bills get to Washington? Rebecca answered, federal bills originate in Washington. So if there's anything else you want to add, whether it's for state bills versus federal, I think that might be helpful just to clear things up for people.
Yeah, absolutely. Sorry, I was doing that quickly because I didn't know if we were just signing up. But yes, federal bills are going to literally be born at the federal level, so with federal lawmakers. And then state bills come from the state level. So each state has its own process and timeline for that, just to make it fun. You have to figure out when they're in session. Some of them are 2 years, some of them are a couple of months. But there are some great sites, national conferences, state legislatures, for instance, where they track, 50 states' activity, and all of your legislatures have websites that will tell you when they're in session and what the timeline for that is. There are some bills that come from sort of national organizations like model bills. And so you might see them replicated across the states because somebody wants to sort of rubber stamp an idea. But yeah, most of the time you can pretty clearly tell whether it's a federal or state bill based on who introduces it.
Let me see. I think another good question the Susan asked, but we can kind of delve into it a bit more, is just um, what are some of the um, what's some of the friction and the barriers that we've been seeing for some of these bills, whether in terms of cost or in terms of legislation that can be harmful to IVF? I think just clearing that up would be a bit helpful for people.
Sure, I can take that one. I touched a little bit earlier on some of the restrictive bills that we saw earlier in South Dakota, and that is actually a bill that we have seen, as Becca mentioned, it as a model bill that we've seen pop up in other states, South Dakota, Tennessee, and there's one other state, I think it's escaping me right now, but there's another one. But this kind of surveillance or embryo regulation bill that we've been seeing on trying to regulate what clinics can and should be doing and who they should be sharing information with is something that has been kind of newer in the past year or so that we've seen. And we really, worked really hard in South Dakota to really get the patient perspective in there and what this would mean, especially in a small state like South Dakota with very few clinics. If they were to publish this information on the health department's website, there are only so many people that are, going through this process, and it's really kind of like a violation, and it could be incredibly invasive and, revealing into who's seeking this type of care because it's just such a small community in South Dakota, and there's only two clinics. So it's really just an over policing and over regulation of what clinics are already required to report on. And so that's something we've seen recently in terms of restrictive bills. There's also something called personhood bills is kind of the real issue we've been dealing with since the fall of Roe v. Wade, equating an embryo with the rights of a live human being, a person, and the dangers and the harm that could cause to providers who might be, held liable for, if there is, you know, if an embryo may doesn't make it, or if a couple chooses whatever they choose to do with their embryos, and if they'd like to genetically test them. Those are some of the issues that I think have been most pertinent in the past year or so. Aisha, I don't know if you have any others you want to add in. You also work on some of our state bills.
I think you touched on them. I think the personhood bills are probably the biggest ones right now that are touching our work, and I think the embryo regulation as well. All right, we have another good question in the chat. For state bills, do you have to live in the state to effectively advocate there?
To contact your lawmaker, generally, yes, they would like to hear from the constituents that they represent. So when we send out an action alert, sometimes we'll send out an alert to neighboring states because some bills may travel, and you might see a copycat bill in a neighboring state. But if we're asking you to contact your lawmaker about a certain bill, it needs to be your actual lawmaker from that represents you in the state legislature or in Congress in order for them to kind of weigh in and hear your opinion and assign the weight to it that it deserves.
Okay, another good question, which I answered it in the chat, was, is it too late or too early to start setting up meetings and emailing legislators now?
No, it's never too late. I think, it's always a good thing to build a relationship and, starting as soon as possible, is always the best time to start now. I think, for federal lawmakers, August recess is generally when they're back in, their home districts. And so it might be easier to schedule a meeting with them in your hometown, in your home state, during August. But, they will answer the phone and their staff will answer the phone year round. And they're happy to, connect, however way, is easiest for you. But you can always send a letter. You can always, call their office, their district, or their DC office, and let them know, any type of, bills that they're supporting or anything that you'd like to see them weigh in on or an issue that you might be having want to bring to their attention. It's all fair game, and you should start now.
Yes. And I just want to reiterate that we do have the Resolve State Toolkit on our website, and I'll add the link to the chat, but you can always use that toolkit for templates, just emails, however you want to reach out to your lawmakers. Um, Another good question, let me see. How do we know when things are being introduced? How do we know how to time our advocacy? At least I can answer that if you want. But
Sure.
again, I want to reiterate for everyone, please sign up for our Resolve Advocacy Network if you haven't done so already. Whenever a bill is introduced, we do have it on our website. We have a list of so many different bills on our website. We keep them categorized by state, so you could always filter it by your state and see all of the bills that have come out. And you can always email us at info@resolve.org just to check in about some of the bills if you have any questions. But I'd also say that for some of the bills, especially IVF fertility preservation bills that we are advocating for, or bills that are bad, that we don't want to move forward, we will send out those action alerts and we will let you know when bills are being introduced. If we need you to do any advocacy, we'll let you know how to time things, if there's hearings, when to show up, where to show up. We'll give you the script. Again, we try to make it as easy as possible to be an advocate. And as well, if a bill passes, we will always send you an email, or if a bill even passes through a committee, we will send you an email to let you know this is what happened, these are the next steps, this is how we might need you to advocate further. So again, we try to communicate as much as possible with everyone, and we try to make it pretty easy for you to get involved and to advocate. Thank you. Marnie Beck from Resolve added where you can sign up for our action alerts, Resolve Action Network. Thank you in the chat, everyone. Okay, let me see.
Let's do one more question.
Okay,
We're
one
running
more
up on time here.
question. Um, Let me see. I think we've answered most of the questions. Yes, I think we've actually answered all of the questions at this point.
Perfect. All right. Well, thank you everyone for joining. If you have any lingering questions or something pops into your mind, feel free to reach out to Becca or, Resolve. It's the advocacy at resolve.org is the email to contact all of us. We're happy to answer any questions. Please sign up for, Resolve's Advocacy Network and stay tuned, stay informed. And thank you for starting with us, your Advocacy 101.